Hello, everybody. It's Laurie White with the Greater Providence Chamber of Commerce, back with another edition of Chamber TV. This is episode number 178. And today, as we enter truly in the lead up to the fall health insurance renewal season, we have a very timely and interesting guest with us today. His name is Paul Bartosic, and he is the Vice President of Commercial Accounts at Tufts Health Plan, a fantastic member of the Greater Providence Chamber of Commerce. So welcome to Chamber TV. Paul, how are you today?
I'm well, Laurie, and congratulations on episode 178.
Yeah, so we started these just as the pandemic started, as a way to, just provide timely and interesting and valuable information to our members, and we've really enjoyed doing them. So we're continuing to do them and shine a spotlight on some of our very prominent members. So thank you for being with us today and talking about this issue, which is probably one of the most important issues to employers today, because it is such an expense, the whole notion of health insurance, and being able to offer a comprehensive package to your employees is a way to, quite frankly, be sure that you are out there with a competitive product, as everybody is struggling with recruiting talent and keeping talent. Certainly having a first-class health insurance package and benefit package overall is a very important consideration. So with that, tell us the exact name of your company. I want to make sure that we're all on the same page here, Paul.
Sure, Laurie. So the name of our company, as we operate in Rhode Island, is Tufts Health Plan, a Point 32 health company.
And that came about as a result of a merger not too long ago, right?
Yeah, so about a year and a half ago, Tufts Health Plan combined with Harvard Pilgrim Healthcare. And then with that, we formed an organization known as Point 32 Health. We do operate under the Tufts Health Plan brand, both in a Medicaid as well as commercial accounts insurance perspective here in Rhode Island.
Fantastic. So I mentioned at the top of the program that November is Open Enrollment Month for Tufts. So tell us a little bit about, what exactly that means, and if you're watching as an employer that might be interested in shopping around and comparing rates and benefit packages and profiles, et cetera. What does that mean, and what should a potential account be doing right now?
Sure. So in general, when we talk about open enrollment, that is the time of year when many employees are asked by their employer to choose their health and other benefit options through that employer. Many employers, probably the vast majority throughout Rhode Island and quite honestly throughout the United States, typically renew their coverage with their insurance carrier on January 1st of any given year. So as a result, for January 1 of 2023, about now is the time that many employers will be asking their employees to choose a health insurance option for 2023.
Okay, so who in your great experience, long time tenured professional in this field, what are the drivers for decision making?
One of the key drivers that many employers look at is basically what you said. You hit the nail on the head, especially given the economic environment, is to attract and retain key talent to an organization. And then beyond that, typically what many human resource and finance professionals within any given company look for, first and foremost, is what sort of plan design should I offer to my employees? There are typically two very popular designs. One is called an HMO, or Health Maintenance Organization. Typically, that is in-network coverage only. So typically, the insurance company has a panel of physicians and hospitals by which the employees are able to access that in-network level of care. Many times an employee is asked to choose a PCP, or primary care physician, to help that employee and his or her family navigate their care throughout the course of the year. The other key option, in addition to an HMO, is what's called a PPO, or Preferred Provider Organization. That coverage tends to be a bit more broad, in that there tends to be national network coverage for employees and their families who choose that particular plan design, and there's no need to elect a primary care physician. However, certainly having a primary care physician is always helpful, regardless of whether you're enrolled in an HMO or PPO plan design.
Yeah, so thank you for explaining the difference, and I think that's a key element to, a lot of employers may in fact, just have either a Rhode Island based domiciled workforce, or many, in fact, have employees around the country. So, is that one of the considerations, Paul?
I'd say that certainly is one of the considerations that any employer should look at. And more often than not, especially larger employers, they may offer multiple plan options. So they may offer an HMO plan design, in this case, for their Rhode Island employees who may not be frequently traveling or have family members living outside of Rhode Island, but then also offer a PPO option. So really, the best of both worlds, employees have the ability to choose what plan design works best for them and their family.
What are some of the trends that you're seeing these days in I won't call it completely a post-COVID environment, but as it becomes an endemic, what's changed in the health insurance industry?
Well, I think one of the key areas that was really propelled by the pandemic over the last couple of years is the increased use of telemedicine. So whether that is hospitals, physicians having some sort of telemedicine offered to their patients, most health insurance companies, Tufts Health Plan certainly included, does have the ability for members to choose a teledoc to be able to access their care. And that's very handy, not just for, obviously, in the case of the pandemic, where it may be difficult to go into a provider's office, but if I'm somebody who's traveling, or maybe I have kids away at college, opportunity for them to access the benefits and care.
What about the whole issue of mental health? We've certainly known that the pandemic has created chaos, really, among the population relative to taking care of family members and their kids, and the stress and strain of the unknown, and the various mutations of the virus, again, leading to certain mental health issues that are frankly unprecedented. What are you seeing from the Tufts Health Plan perspective relative to that? And do you have any particular way of approaching mental health issues overall that would be a differentiator for your products?
Sure. So you're absolutely, again, correct that especially with the pandemic spotlighted the need for mental health, behavioral health coverage in a health plan. And oftentimes that is many employers, one of the first things after deciding a plan design is, what does the mental health network look like for that particular health insurance company? And then what are the benefits? Beyond that, Tufts Health Plan will be rolling out in 2023 something that we call Family Defines Us. And that gets to the point, Laurie, that you were just making, that many people our age, for example, we're in the sandwich generation, and we're not only taking care of ourselves, but we have parents and oftentimes maybe younger or college-age children that we're also looking after. So we're putting together a full package of Family Defines Us, capturing mental health benefits, but then also those caregiver solutions for individuals who may be in, as an example that I just gave, of that sandwich generation.
So that's interesting, being able to do sort of wrap around if you have, perhaps parents or in-laws living with you. Is that what you're referring to with, a wide variety of different family constellations, or what's called family?
Yeah, I think that absolutely is spot on. I think many of us know that the quote unquote traditional family of a mother and father and whatever the Census Bureau said, 2.3 kids, that's not necessarily the reality for many families today. So like you said, there are many makeups of a family, and Tufts Health Plan is trying to address each unique and need that any given family may have.
Is that a fairly new offering on behalf of Tufts Health Plan? Is it unique in the marketplace?
We believe it is. We believe that focus on what defines a family is indeed unique, and we'll be sharing more about the Family Defines Us product over the coming months as we do get into and closer to 2023.
Fantastic. So again, our audience is employers, and generally speaking. So let's talk a little bit about what an employer needs to think about. Certainly the bottom line is important. So where does the bottom line stack up, if you will, in terms of relative attributes when choosing a plan, and how do you help an employer really manage that bottom line?
Sure. So certainly the pricing is very important, as you mentioned, the overall bottom line. What we see many employers focused on is not just the pure bottom line, but really taking into account what is the value I am receiving from that particular health plan in terms of the type of coverage. What are the cost shares that my employees may have as part of the coverage? Are they set copays? Are they high deductible health plans that can be paired with a health savings account? There are many different financial components that I would say most employers do indeed take a look at versus just the bottom line premium.
So you mentioned a high deductible health plan with a health savings account paired with it to work down that high deductible but be able to offer that plan and those benefits on a tax deferred basis or a tax favorable basis. What percentage of your plans do you estimate opt for that type of configuration?
Sure. And this is really an example where, again, many employers do offer an HSA qualified health plan. I would say, anywhere from 25 to 50% do offer that type of plan. Many times it's alongside a different, more traditional plan design. Again, getting to that idea of employee choice. Certainly key as we've seen the growth of high deductible health plans. I'm really trying to help educate members about what does that mean. So Tufts Health Plan, for example, last year rolled out a program that we called Smart Start. That Smart Start program is really an onboarding program both for HR professionals who may choose to move their health insurance to Tufts Health Plan, but then even more importantly for employees who are trying to navigate what can be a very complex decision in terms of deciding which plan design might be most effective for them and their families.
So is Smart Start an entry level plan, if you will, with not a lot of bells and whistles, for lack of a better term? Is that how you would describe what Smart Start is?
So actually what Smart Start is, it's a program that's attached to all of our plan designs in Rhode Island, and it's really an opportunity for members to engage with Tufts Health Plan even before the effective date. So that way, if my employer were to choose a high deductible health plan as an example, alongside maybe an HMO plan with set co-payments, I, the employee, have the ability to work through the Smart Start program and call center team to identify which plan design really makes most sense for me and my family. So it really is attached to all of the plan designs that we offer in Rhode Island.
The notion of digital health, you talked about telehealth and the ease of that, depending, of course, on what the situation is, what the condition is. Can you speak broadly regarding digital health, digital portals? What are some of the aspects of this that might really be appealing to young millennials, as an example, that are used to or actually might even prefer not dealing with a person, but rather, looking at their options, looking at their utilization, looking at the whole host of benefits through a digital means?
Sure. And what's actually interesting, and I'm not sure that anybody thought that this would necessarily occur, but we actually see all age ranges very interested in whether it's telemedicine, the ability to have that convenience in my home, not having to take time away from work for doctor's visits, as an example. But then in addition to that, as you did mention, many of our insured members through our employer groups are very interested in how can they have self-service and access information when they want it at their fingertips. So Tufts Health Plan has built out a very robust online web portal for members really to access pretty much anything they need to know about their health plan, whether it's understanding what are their cost shares, what's the impact of their bottom line as an employee accessing care, access ID cards, access explanation of benefits after a visit with a physician or at the hospital.
How what is the most, what would you say, the most popular configuration of benefits for a health plan today? I'm sure it runs the gamut, lots of different ways to present an offering to your employee base, but is there one particular profile that you see to be the most commonly used, the most commonly requested?
It really does vary by employer. Certainly each employer has special needs in terms of their own demographics of their employee base. As we mentioned, some employers may predominantly have the bulk of their employees in Rhode Island accessing care in Rhode Island. Many may have family members who live throughout New England or really throughout the country. So often what we find is employers really looking for that choice and offering multiple plan designs within their employee population.
I know a lot of our members are self-insured and might need an administrative only type of contract. How do you approach that segment of the market?
Sure, absolutely. And in addition to what's considered fully insured programs, everything that I mentioned also is available to all of our self-insured employers. For those in your audience who don't know, self-insurance is just another mechanism for an employer to be able to basically pay for the health insurance coverage for their employees. Certainly, if anybody has any questions about that, certainly you can reach us at tuftshealthplan.com to learn more about the different options that we do offer. But Laurie, everything I mentioned is available whether the employer is fully insured or self-insured.
Great. So thank you, Paul, for clarifying that. Let's
Sure.
talk a little bit about healthcare prevention, wellness programs. So we're in an era where the plans are playing a proactive role in helping an insured population improve their overall health. So many know that, back in the day, that wasn't necessarily something that the insurance carriers would actually, drive as an issue. So let's talk a little bit about, what you're seeing from, trends around that. What types of, preventative health plan or preventative programs are being offered today in the marketplace that would, really help an individual understand his or her own health profile, some other risk factors, self-diagnosis, quizzes around various BMI measures, other things. So talk a little bit about how your program, your offerings help to lower the overall population health, issues or the cost or the cost trends.
Sure. So a few things, especially knowing that our audience today is primarily employers. Please, employers, make sure that your employees understand that preventive health is a 100% covered benefit, whether it's a PPO or an HMO plan design. We find that many members are not aware of that particular benefit, and we think that's very key in that it really is an opportunity to make sure that members are having that annual well visit, physical visit with their physician to be able to identify, are there areas of care that I as an employee really need to focus on? So for example, am I pre-diabetic? And then would I benefit from some sort of coaching program through Tufts Health Plan as part of our Smart Start program as just one key example. And then beyond that, certainly we do offer coaching programs to employees who might find themselves or their family members in a situation where they have a chronic condition and they really need help navigating the healthcare system. Those coaching programs are available through Tufts Health Plan so that a member is able to engage with our practitioners, nurses, and doctors to be able to make sure that they can get the care that they need at the right time in the right place.
We are talking to Paul Bartosic, and he is the Vice President of Commercial Accounts for Tufts Health Plan. And we're talking all things health insurance in the run-up to open enrollment month of November as the new plan year takes place and kicks in January. So we've covered a lot of ground so far, and we're talking about wellness and prevention and preventative programs, coaching, and the like to help bend the cost curve, as one might describe it, in terms of overall reduction in healthcare utilization. So with that, Paul, say a little bit more about, in addition to, some of the more popular and commonly known programs like smoking, what other health and wellness and preventative programs might Tufts be looking at that might be just a little bit different?
Sure. So it really does get down to, one, educating members about the benefits that they do offer, that their employer offers in that the 100% preventive care coverage. But then beyond that, really depending on the member, there are opportunities for smoking cessation programs, as you did mention. Perhaps I am somebody that, again, I think I use the example of being a pre-diabetic, opportunity for various coaching programs, and or maybe I am somebody that is interested in going to the gym every so often and able to have some sort of program where I'm incented for use of those different wellness activities. So we really look for the entire spectrum of the member, recognizing that every member certainly has different needs.
Yeah, I love those gym membership covered benefits. How does that work? Is it just any gym? Is it if it's a more expensive personal training type of situation? Is that covered? How does a gym membership work as a a piece of the product of a health membership?
It really does vary by employer offering. It could be as simple as every time I go to the gym, perhaps my employer incents me a couple of dollars each time, basically maybe making my gym membership almost free in a given month. There are many other programs out there that might be more complex. That may require logging in every so often and sharing information such as your BMI, weight, other information like that with the health plan. So it really does depend on what the employer is choosing to offer.
In the aftermath or in the life post ACA, what's changed in the marketplace relative to small business and also to take up of health insurance among employees?
Yeah, Rhode Island certainly, historically was always a state that had a fairly high rate of insured population. So that has certainly continued post ACA, as you had mentioned. Certainly what employers are very focused on now, we're finding, is that ability to attract and retain key talent, which is why they're looking under the cover, so to speak, more and more in terms of what is their health insurance offer and what are the plan designs available to my employees.
Yeah, so I'm curious about that. What so you're an employee, you're highly marketable, highly skilled, you have lots of offers. Perhaps you want to work remotely. That brings up another issue I'm curious about. But we'll park that for a minute. The whole notion of remote and are remote workers healthier or not. But back to the core question: what are those little nuggets that could really make the difference for an employer in terms of really smart, innovative plan design that would make a difference and tip the balance in terms of an employee saying, yeah, I want to go work there.
I'd say a big key that many employers want to be able to tackle when it comes to that is being able to share a holistic view of the benefit design with those employees or those prospective employees. One, again, what is the plan design coverage I'm offering? If I am going to have a remote workforce, do I have a plan design that meets the needs of somebody who may not be physically in the state of Rhode Island? And then also more and more, we are starting to see employers really take a look at what are the other plan design benefits that they offer beyond just health insurance. So, for example, what does the dental insurance coverage look like, vision, life, disability? Those all become very important components when a prospective employee is looking at choosing a given employer.
So what about remote workers? Are they? Do you have any utilization data that would indicate if remote workers over time are likely to be healthier or less so because they're sedentary? Is there a particular cost trend that you're seeing with the advent of remote or hybrid work?
I'm really not aware of any studies as it relates to that, Laurie. However, what I can tell you, especially during the pandemic, and now, even though the pandemic is somewhat behind us in terms of so many employees still working remotely away from a physical office, one of the things that Harvard Pilgrim Healthcare and Tufts Health Plan did early on in the pandemic is make sure that we offered our well-being and wellness seminars to all employees, whether they were physically on site or they were working remotely from somewhere else. And we've continued that. So many of our well-being sessions, for example, mindfulness sessions led by one of our mindfulness coaches, those are all available for both on-site employees, but also those who may be remote.
I'm kind of curious about again the whole notion of remote work and also long COVID. Long COVID is a topic that we've gotten into a lot here on Chamber TV. We did an episode a couple of weeks ago with the School of Public Health at Brown University, and they are spearheading a first of its kind national international study on the impacts of long COVID and what employers are seeing and what they're looking for in terms of coverage, diagnosis, accommodation, and the like. What is your perspective on long COVID? And it's estimated that almost a quarter of the population may, in fact, at some point be suffering with long COVID.
Sure. It's something as a health plan that we're watching and paying attention to see, as you said, there are many studies out there trying to understand what is the ultimate impact and indeed how many people do we think may and have some symptoms associated with quote unquote long COVID. So it's something that we are watching to understand over time. Are there ways that we may need to evolve in terms of coaching and health coaching for those particular employees who may be suffering from long COVID. So it is something that we're watching and monitoring. I don't have an answer for you today in terms of what we may ultimately roll out as it relates to that, but it is something that we're looking at closely.
Yeah, that's interesting because it does probably, from an insured perspective, have a long tail relative to perhaps somebody doesn't recognize immediately that that's what it is, but
Sure.
down the road a piece, the notion of really being unwell for a protracted period of time creates a certain set of dynamics for all the health plans, right?
Absolutely.
So we've covered a lot of ground here. I want to cover one more topic and then potentially ask you to, summarize what, the value proposition of the Tufts Health Plan. But let's talk a little bit about interactions and Tufts relationships with the healthcare community. So particularly hospitals in Rhode Island, we know that each of them is under a fair amount of stress, financial stress these days. What kinds of contracts are you able to bring forth with the overall provider community that would give your insureds some true peace of mind if were to they be hospitalized or have some sort of catastrophic event?
Sure. So in Rhode Island, we have a fantastic relationship with all of the larger health systems, have a very robust and large network of physicians throughout Rhode Island and really throughout New England. So if we have members who are accessing care in Massachusetts, either because they live close to the border or may have family members living in Massachusetts, there's also adequate networks and coverage available there. So I can't certainly get into any specific provider contracts, but I can say that we have a fantastic relationship with all of the larger health systems and certainly continuing to work very closely with them to make sure that we can provide a high level of quality care to all of our members at Tufts Health Plan.
Yeah, that's fantastic. We have strong relationships with our hospital and academic medical center partners as well. They're important members of the chamber and also key contributors to the economic development vibrancy in Rhode Island. And under the new dean of the medical school, Dean Jane at Brown University, we expect a lot of really interesting things to happen soon in the Knowledge District, the former 195 lands, where there will be a lot of new investment, a lot of lab space, wet lab space for research purposes coming to the market, and also lots of opportunities for great interaction with the hospital community to really forge really close and insightful relationships with patients and with members that are experiencing the overall healthcare system in Rhode Island. So we have only 2 minutes left, Paul. So let me ask you to summarize the Tufts Health Plan promise, the message, if you will, and what employers might want to do after listening to this, if they have additional questions, and how they can follow up.
Sure, certainly. And again, thank you, Laurie, for having me here today. So again, if you're interested, you can always visit tuftshealthplan.com. Certainly, Tufts Health Plan, as a not-for-profit local entity here in the state of Rhode Island, we're very committed to guiding and empowering Rhode Islanders everywhere to have the healthiest lives possible. So we're very interested in understanding how do we partner with employers to deliver that high quality of care through various plan designs, cost share arrangements to their employees. So again, Laurie, really appreciate the opportunity to be here today and talk a little bit about what Tufts Health Plan has to offer Rhode Island.
Yeah, so you are Vice President for Commercial Accounts. So how would somebody get in touch with you directly?
Certainly. So actually at tuftshealthplan.com, you do have the ability to access Rhode Island information. Find my contact information there. I'd say more often than not, most employers do work through a broker or a third party. And we do have a sales team and an account team ready and willing and able to help all of those brokers secure employer insurance.
Of course, and the broker community is a key element of our membership base as well. Lots of really strong and talented brokers that are members of the chamber. So that's certainly a great option as well. So that concludes our interview. Anything that we didn't touch on, Paul, that you'd like to mention before we say goodbye?
No, I think you hit on everything. And again, thank you very much to the Chamber. You do a lot of great work throughout Rhode Island, and we're humbled to be a part of that experience.
Thank you, Paul. Thank you for being with us. A lot of great information, and look forward to catching up with you very soon. So take care, everybody. See you next time.